On your Daily Detroit for Monday, October 12th, 2020, Michigan is now at risk of a coronavirus outbreak. Dr. Paul Thomas helps us break down why and what's next for this pivotal week, including why herd immunity, as suggested by local Republican leaders, would be a very deadly path to go down. Plus, hundreds of thousands of Michiganders could see their records expunged, including those for marijuana offenses. Fines have been issued around the recent land collapse into the Detroit River. A creek in Warren has been cleaned up. A Buddy's is opening in Troy. And it's Indigenous Peoples Day. So I take you on a little journey talking about Detroit's names before it was, well, Detroit. I'm J.R. Stays, and let's get started after I thank our members on Patreon, including Seth, Lauren, Emily, Amber, and others. Your support is crucial as, frankly, local media operations are among the hardest to make happen and fund, especially in these times. Also, Bob, Kate, and others, we've been packing up your bourbon glasses to get them out. It's quite exciting. So if you value what we're doing, consider becoming a member at patreon.com/dailydetroit. That's patreon.com/dailydetroit. On the heels of new higher case totals over the weekend, including more than 1,500 daily confirmed cases, as well as COVID Act Now listing Michigan as a state that is at risk of outbreak, I felt like it was very important from a public service perspective to dive into what's happening. And to do that, you know who I'm talking to. It's Dr. Paul Thomas from Plum Health Direct Primary Care. Doc, welcome back, sir.
Hey, it's great to be here, man. But, not great circumstances.
Right? I wish we could talk about something more fun, but we just really can't right now because this seems to be a pivotal moment on what's happening with Michigan. I'm looking at these daily new cases per 100,000, and we're back to where we were in parts of April.
Yeah, it's really sad. It feels like we've gone backwards, and there's probably a lot of different reasons for that.
Well, let's get into some of those reasons. It would be important to note the response and the case level is different depending on where you are in the state. Although we are seeing uptrends here in Metro Detroit, especially in Macomb County, there's other areas like the city of Detroit that actually have seemed to keep things at bay, and their positive test rate is less than half of that of the rest of the region. First off, what does that positive test rate mean, and why is it important that Detroit's keeping it down?
Well, that positive test rate means that of all of the people who are tested, you have a positive rate of, let's say, 1% or 2%. And the lower that number, the better it is for your city, state, or region. And so I think Detroit is doing a really good job of enforcing mask wearing, especially at places where people hang out, like bars and restaurants. A lot of small business owners have been very good at having signs on their doors and making it like culturally normal for people to wear masks. And that's something that's really going to help us as we go through this pandemic. And it's showing its evidence right now with a low positive test rate in the city of Detroit.
And that's good news, but there is kind of harrowing news statewide, and so much so that there was a letter sent to the Senate leader, Mike Shirkey, who's a Republican. And when I sent this over to you, you were kind of like, whoa, and explain that for me.
Yeah, so this came out today, October 12th, 2020. Dear Majority Leader Shirkey. And it's a nicely crafted letter from some leaders in the physician world across our country. So Joshua M. Scharfstein, MD, professor of the practice in health policy and management at Johns Hopkins School of Medicine, Public Health. And then you have Ashish Jha, MD, Dean of Brown University School of Public Health. These are some really big names in the physician world, very well-respected doctors who are speaking out and calling out our state legislature in a publicly shared letter telling them that they need to follow these guidelines of wearing masks, washing hands, making these mandates available, because this is the way that we're going to reduce the spread of the infection and protect Michiganders going forward.
Well, one of the concerns that I keep hearing from listeners is that we talk about what's happening in the city of Detroit, but outstate, there tends to be a lot of issues. Macomb County is right now considered an orange area with accelerated spread, much more than community spread. It's leading the rest of the region in this nefarious kind of category. And then some other places, especially upstate, are seeing these outbreaks. And although you've got the intensive care units down here. Up there just aren't as many, and there's a lot of concern in some areas, right?
Yeah, I mean, there's been outbreaks in the Upper Peninsula now, and there's been outbreaks in Macomb County, like you mentioned. This is much more of a statewide issue, and this is why it has the potential to boil over and become much more widespread. It's because it doesn't seem like other communities are taking it as seriously as Detroit has taken this. Because we were hit early, because we had so many deaths, we took this really seriously. And perhaps people outside of the city think that it's just an urban problem or it's just a Detroit problem. But these case rates in the Upper Peninsula are shocking. People need to take this seriously. I went on a little road trip at the beginning of September up to the UP, and the culture there was not to abide with mask wearing. So it was kind of rare to see people wearing masks in public places and inside restaurants. So it was a bit of a culture shock. And I think we're seeing the fruit of that cultural issue with not embracing mask wearing and social distancing.
Well, one of the tropes that's coming back with all of this is this idea that we want to head towards herd immunity with some folks, with especially the right side of the aisle. Can you kind of address why that isn't really a great thing? Some of the statistics I saw were eye-popping around if we tried to choose that as a path. And that's something, to be clear, that's been floated by a number of folks who just don't have the same understanding scientifically of the virus.
Sure. Yeah, so let's talk about that. If you want to reach herd immunity for most infectious diseases, let's say polio or influenza, you need to have about 50 to 70% of the population who's either been vaccinated or who's recovered from one of those infections. And so with the flu vaccine, we try to vaccinate as many people as possible so that we get some kind of protection, some kind of herd immunity. We don't even have a vaccine right now for this coronavirus, for COVID-19. And so we can't use that as a tool to reach herd immunity. What Mike Shirkey had said is, I'm also a big believer that there's an element of herd immunity that needs to take place. Well, if we want to get to herd immunity, we need about 50 to 60% of people to basically get coronavirus and recover. And statewide, we've only had 134,000 cases as of today, and that's only 1% of our population. So basically, you would need to get 60 times that number of cases. So you need about 6 million confirmed cases in the state of Michigan, and that would put you up to around 90,000 deaths. So if that's what you want to do, that's a very dangerous game to play. And I think that's the wrong approach to preventing the spread of coronavirus.
That is an insane number. And we talk about the number of deaths nationally. To see something like that number that's approaching 100,000, I mean, that's just, I'm kind of stunned about why people think that this is an all right way to go. And Dr. Anthony Fauci, even in a congressional hearing, has, refuted the data around this thing, but it's something that is continually, it's misinformation that's continually peddled. Why do you think that is? I mean, it's just so clearly incorrect. And why is it given so much space and time?
I think it's because this has become such a hot political issue. I think, for one, President Trump is trying to be reelected. I believe that he's still downplaying the virus and not taking it seriously. Just looking at his comments coming out of the hospital, he's saying that, he was able to beat the virus by taking a specialty cocktail of medications. He made it seem like the virus wasn't a big deal, all, while struggling to breathe after getting, roughly $100,000 in private care. He got a hospital ride to the Walter Reed Medical Center, and he got tens of thousands of dollars in specialized care once inside the hospital. And the reality is that Americans, by and large, don't have access to that kind of excellent care, top-tier care that might be available to somebody like President Trump. And I think that really plays into people's psyche when they see somebody recover like that. That anecdote becomes much stronger than the data, and it's really hard to shake that in the population.
I've heard multiple reports now of, in the local sphere, of people doing sporting events, folks shopping, things like that, without masks, that although there might be some folks who wear masks, there is this pushback that it isn't a thing, or that kids can't get it, all that kind of stuff. What are your concerns around that, and techniques for folks if they're in a situation where maybe their kid is, playing sports or doing things, but maybe the other side just is not abiding by best practices?
Yeah, I mean, those are really tough positions to be in as a parent because you want your child to participate. And, if they're wearing a mask and ready to go in that respect, it'd be terrible to see the other team take the field like on a soccer field or a baseball field and have the other kids not wearing a mask. And that's really difficult. That's where we need to stand together as a state and come together and understand that wearing a mask is going to be temporary. It's probably going to be another 6 months to 18 months. And if we can get through this time together, we can decrease the spread of the virus and save lives and protect each other. And that's something that's really difficult, but it starts with our national leadership, our president. It starts with our statewide leadership in the Michigan legislature, our governor, and what they say and how they behave matters. And when they set a good example for everyone, it's easier to follow. Unfortunately, we don't have that. So it just becomes this really difficult situation where you're having individuals and communities decide what's best for them. And it's come at a disastrous result for our state, just looking at the number of cases and the number of deaths.
I know a lot of our listeners are going to be interested in this, so I'm going to ask about it. The state's orders reopened indoor service for bars over the weekend. That happened late Friday, so that if you're seated and socially distanced, there's service available, as well as a number of bars have been doing tents, temporary barn-like structures with open side doors, as well as these kinds of individual domes where your table is covered by a dome that kind of keeps you and your party separate from folks. How do you feel about those eating out options? We talked about kind of guidelines before. As we head into winter, how do you feel about those options?
I think it's a really tough situation to be in as a Michigan business owner, especially in the bar and restaurant industry. But I applaud the efforts of our local entrepreneurs, restaurant owners who are trying to make those accommodations available. We've seen places like Batch Brewing, places like She Wolf, a few other places who have erected these outdoor tents with heated areas. And I think it's better than dining inside and drinking inside because it does have an element of outdoors and better air circulation. It's not perfect, but if it's a must-do for you to go out, maybe this is a good alternative. Using those individual pods are reasonable as well. Just making sure that you're with a small party of 10 or less and making sure that people are comfortable sharing about possible exposures with your friend group, because it really is going to come down to who you're close with and who you're spending the most time with. And that's how the virus has been spreading in small groups, family units, close friends. And that's the tough thing about this virus, is because it's just hard to keep your guard up 100% of the time. But once you take down your guard, you become vulnerable to the virus.
Well, that is a concern, right? Because I think a lot of folks feel like if they know someone that they're safe, but that isn't necessarily the case, right?
Right. It's because we don't have a sophisticated contact tracing in the state of Michigan right now. So it's really difficult to tell. You may have run into somebody 10 days ago at a bar or restaurant, unbeknownst to you, who's a positive case. And then we don't have a sophisticated contact tracing where you might get alerted that there was a positive case nearby. Remember when we were trying to do this thing with smartphones, where we were trying to develop an app for contact tracing? That just never happened. And, something like that would be a reasonable tool to combat this. But we're just not that sophisticated yet to deal with this.
And nor do we have enough tracers. According to COVID Act now, the state only has 18% of the number of tracers that they would need to be sufficient, even with best practices. So we're basically extremely underpowered still.
Yeah, it's a really tough situation that we're in.
All right, so I'll leave this with what's next. What's your advice for folks this week? What to look for, since, this seems to be a pivotal week ahead?
The cavalry is not coming. We've been told for how many months now that, the vaccine's going to be ready. The vaccine's going to be ready. And frankly, the vaccine is not going to be ready. I don't think it's going to be ready for at least another 6 months at best. It takes about 18 months to develop a vaccine. Even if it is available next month or by January 1, we still have to produce that vaccine and distribute it. So it's going to take another 6 months at least to get widespread adoption of that vaccine. What's the best thing that you can do in the meantime? Wash your hands, wear your mask, and do your best to keep physical distance between yourself and others, because that is your single best tool at preventing the virus and its spread.
Dr. Paul Thomas, Plum Health Direct Primary Care. Sir, it's always good to talk to you. And of course, we'll chat soon.
Yeah, it's been great to be here, and sorry to be a downer on this, but I got to leave you with some good news.
All right.
The Lions did not lose this weekend, which was great.
Hundreds of thousands of Michiganders could get their criminal records expunged under a new bipartisan set of bills signed into law Monday by Governor Gretchen Whitmer. Dubbed Clean Slate Criminal Justice Reform, House Bills 4980 through 4985 and 5120 will automatically remove some criminal convictions from the public record and make more residents eligible. Comments of support were made by both Democratic and Republican leaders. Key in it are provisions around marijuana offenses. It sets aside one or more marijuana offenses if it would not have been a crime if committed after December 6, 2018, when recreational marijuana use by adults became legal in our state. But there is more. Many misdemeanors will be cleared 7 years after sentencing, and felonies will be 10 years after sentencing or the person's release from incarceration, whichever comes last. There is a limit of 4 misdemeanors and 2 for felonies for automatic clearing. It also expands the clearances available for traffic offenses, though this isn't a free pass for all. There are a number of crimes that do not fall under this new law for automatic clearance, including those around assaults, crimes of dishonesty, so think counterfeiting and forgery, those with 10 years or more in prison, or crimes that involve vulnerable adults, minors, injury, serious impairment, human trafficking, or death. But the new laws will have a big impact here in Detroit. About 80,000 people now will be able to apply for jobs and other opportunities due to their records being cleared. Listeners of the podcast might remember we covered back in November of last year that 200 feet of the Revere dock collapsed into the Detroit River after too much aggregate was placed too close to the shoreline. Located in southwest Detroit off of West Jefferson, the owners of the property, Revere Dock LLC, will be fined $60,000 for violating the Natural Resources and Environmental Protection Act. The consent agreement between the company and the Michigan Department of Environment, Great Lakes and Energy, we'll call it EGLE from here on out, covers 4 alleged violations. As part of this, EGLE has issued a permit allowing Revere Dock to proceed with its restoration plan to install a 600-foot steel seawall. Plans call for sediment and bank failure material that spilled into the river to be removed. All of this work is supposed to be done by July of 2021. The land was for more than 60 years the location of Revere Copper and Brass Company, which operated before modern environmental laws and, well, had some pretty bad contamination at the time. The state says that in the 1940s and 50s, Revere manufactured uranium rods on the site under a contract with the U.S. Department of Defense. After the manufacturing facility was closed and demolished, at the time, the Atomic Energy Commission and the Environmental Protection Agency determined there was no radiological contamination on site. Tests by EGLE after the dock collapse showed the presence of radiation at normal background levels. A $1 million creek cleanup has wrapped up in Warren. In 2019, a diesel leak was found flowing into Bear Creek near Mound Road, north of I-696. If you didn't know, Bear Creek starts in Oakland County and runs through Warren to the Red Run Drain, and that empties into the Great Lakes. A 150-foot long, 20-foot deep section of riverbank was removed and restored. During the excavation, a rotted pipe with old diesel fuel inside was discovered. The Macomb County Public Works Office says that diesel fuel may have been going into the ground many years earlier under previous property ownership and before the gas station that's nearby was built. The cleanup was paid using Michigan Underground Storage Tank Authority funds. Local pizza chain Buddy's is opening a new location in Troy on Monday, October 26th. The 6,700 square foot restaurant will be at 987 Wilshire Drive, so think Big Beaver and Crooks Roads. It will seat more than 200 people, including 40 on the patio. There's a see-through glass block window to see how it's all made, and this location's going to have a retail store selling Buddy's branded clothing and memorabilia. Beyond their pizza, which most everyone knows, they'll have gluten-free options, craft beers, and their own 2 beers, Buddy Brew and Bocce IPA. Before I get into this next segment, please understand that although I researched and tried my best with pronunciations and data, the understanding around this part of our history is still evolving, and my language skills are limited to English and classical Latin. In the city of Detroit, we do not celebrate Columbus Day. Indigenous Peoples Day has taken its place as we've learned more about the atrocities committed by Christopher Columbus and his fellow colonizers, and more facts have become more widely known around the oppression of Native peoples to settle America, including right here in Michigan. Although most history books talk about the scandalous French explorer Antoine de la Mothe Cadillac and the founding of Detroit being in 1701, people have been living in what we call Metro Detroit since somewhere around 6000 BC. The area was fertile and had many animals to hunt. The river provided a bounty of fish and frogs. During French settlement, it was often remarked how easy it was to grow food. Writings talked about pear trees, corn, wheat, oats, and even grapes for wine. But the French name wasn't our first. There were no less than 4 names given by the indigenous peoples for the area. And the name of our region varied depending on the tribe, according to the book This is Detroit, 1701 through 2001. The Iroquois called it Tuxagrande, the Strait Region, or Place of Many Beavers. Yondotega meant the Great Village in Algonquin. It also reportedly meant Beautiful View. In modern times, it's the name of an exclusive social club founded in 1892 on East Jefferson that has only 150 members and gets new ones only if a previous one died. That's still open, but I digress. Wawatunong is another Algonquin name that roughly means the crooked way. That makes sense when you see the bend in the river. And the Hurons called it Caronten, or the coast of the straits. To be sure, this is a simplified list as this is a long, complicated history, and we're still discovering things as time goes on. But the bottom line is, our area had quite a history and identity before Europeans showed up. French explorers are known to have made contact around the 1660s. They most likely ran into the Three Fires people, who shared culture and language and were known as the Anishinaabe. The 3 tribes consisted of the Ojibwa, Odawa, and Potawatomi. In 1836, large numbers of natives started getting forcibly removed from Michigan as part of the run-up to statehood. There aren't many remnants left of their presence. But every time you drive on Woodward, Michigan, Grand River, and Gratiot, know that they are all, in part, former native trails. Here, we've never been good at preserving our history. Whoever is in charge tends to, over the decades, be it whether it's the case of Black Bottom, the suburban towns turned to strip malls, be it freeways burying places, it seems bent on destroying what was, often making inaccessible areas we could archaeologically learn from. But a few things remain. For instance, there's a little left of a burial mound at Fort Wayne in southwest Detroit. Parents Creek is the site of the Battle of Bloody Run, fought between the British and Chief Pontiac's coalition of the Odawa, Wyandot, and Potawatomi tribes in 1763. You can see the last open portion of that creek in Elmwood Cemetery on the near east side of Detroit. Parents Creek became known as Bloody Run after the battle. And although it looks little like it did after a couple centuries of filling in and extending the lands, Wanabazee, or Swan Island of the Chippewa and Ottawa, is still here. You know it as Belle Isle, the name given to it after the city purchased it. It was originally used for fishing, hunting, ceremonies, and meditation. Although state park officials have an opportunity to fold in far more indigenous history and educational opportunities than they do now. So in that light of finding indigenous lands, a website called Native Land was created by Canadian developer Victor G. Temprano. It gives us a very interesting view of the overlapping peoples. Now, it's not 100% accurate because the source records can be very irregular, but it does show how Detroit was an area that multiple Native nations lived in. I'll put a link in the show notes. On this Indigenous Peoples Day, it's important to remember that sometimes what we were taught in school wasn't the whole story, but the one written by the victors and persecutors. That history is as beautiful and complicated as what was written after 1701, albeit a giant amount of detective work is needed to discover it. Take a moment to honor, remember, and then hopefully go forward and act with new or renewed knowledge this Indigenous Peoples Day. After all, the statue outside of City Hall we call the Spirit of Detroit may have been created in 1958, but the spirits and peoples of Yondotega have been here for thousands of years. And that is all for your Daily Detroit. If you have feedback for the show, our voicemail and dial-a-podcast line is 313-789-3211. You can also email me at jer@dailydetroit.com. With that, it's been quite the show. I'm Jer Stays. Take care of each other, and we'll get through this together.